The patient says that he is able to initiate micturition. He is able to fill the bladder normally. No problem with the storage. He says, I was able to initiate this. Your brain should know what you are asking. ऐसे खाली मंत्र के लिए कर रहे हो और पता कुछ नहीं, then it is of no use. See, when you take the history of the patient now, so normally वो मैंने जानबूझ के नहीं इसमें डाला था because I don't want to give you too much information in one go, then you will not learn anything. Only thing is that कि ideally तो देखो catheterize अगर आपने डाल दिया तो then you will have to take the history what exactly happened. So when I was a student, even now you ask me to take a history, I'll tell you my history will be. The patient says that he is able to feel the fullness of bladder. 1. The patient says that he is able to initiate micturition without, and there is no urgency or hesitancy. Hesitancy means it is not taking too long. He is able to do it normally, and there is no urgency कि यार मतलब कि इतना भी है कि होल्ड ही नहीं कर पा रहा कि इसको लगा और एकदम से हो गया. So I will say that the patient is able to feel the fullness of bladder. He says there is no hesitancy, there is no urgency. He is able to initiate micturition. He is able to feel the passing of urine. He is able to stop in between if he wants, and there is no dribbling, and the stream is normal. And there is no evidence of increased residual volume in the urine. We can't say that exactly because you have to have an ultrasound for that. But the patient says he does not have to go every hour. So there is no increased frequency of micturition, and the amount of urine he passes every 4 to 6 hours is normally in amount. वो ये नहीं बोल रहा कि डॉक्टर जाता तो मैं हर घंटे में हूँ, थोड़ा सा ही आता है, फिर एक आध घंटे में मेरे को फिर जाना पड़ता है. It means it is incomplete evacuation. So if you have all this history, तो at least you can have. ये भी he is able to fill the bladder normally. No problem with the storage. He says I was able to initiate it normally. Voiding normal. And he does not have to go every 3-4 hours, and every 4-5 hours the amount of urine he passes is normal. डॉक्टर ठीक आ जाता है, हो जाता है. It means most likely बहुत ज़्यादा वो extra store नहीं कर रहा है. And he says I am able to feel the fullness of the bladder. It means जो जारी है nerve, he is able, that is working properly. He is able to feel. So that is why when I ask the students to give me a history of bladder, even my PG students जब मैं एग्जामिनर जाता हूँ, they don't give me all this history. I have stopped asking now. मतलब क्या पूछोगे? Because they are not understanding कि what this history is telling you about everything. Storage के बारे में कि these things are intact. You are able to initiate micturition. These things are intact. If you are able to feel the bladder and feel the passing of urine, these things are intact. वो उनको लगता है कि what is the sense यार, फील करा नहीं करा क्या डॉक्टर बेकार की बातें क्यों पूछ रहे हो? Everything is telling you about the integrity or disintegrity of a system. But then you should know कि मैं ये क्यों पूछ रहा हूँ. खाली पूछने के लिए पूछने से कोई मतलब नहीं होता. So if you know all these things, you know what things are working, what things are not working properly. ये तो that is a good history in neurology because but then your brain should know what you are asking. ऐसे खाली मंत्र के लिए कर रहे हो और पता कुछ नहीं, then it is of no use. Bladder feel हो रहा है, ये मैंने बोला, इसका क्या मतलब है? I am able to initiate it normally, इसका क्या मतलब है? I am able to store it normally, इसका क्या मतलब है? मेरा कोई incontinence नहीं होती, मतलब ऐसा नहीं है कि मैं incontinent हो गया, मैंने खांसी करी, कुछ करा, इसका क्या मतलब है? So all this history, everything which is good or bad, it tells you something. So then you have to know this, why we are asking and what is wrong if the patient is giving us this complaint.